Hi guys, this is Amrit and I would like to welcome you to OsProEd. This video is for educational purposes only and please never practice medical skills without the proper credentials. Our topic today is PAC, which is pre-admission clinic. There are a few stations in AMC where they assess your knowledge on PAC related matters, and today I will highlight what happens in PAC. As a junior medical doctor, you will be rotating in a surgical stream at some point, be it general surgery, vascular surgery, orthopedic surgery, or gynecology. And when you do, you might have to go work in PAC. So PAC stands for pre-admission clinic. In this clinic, we try to assist preparing patients for elective surgery. There are unit-specific guidelines that we need to follow. And what we do are things like ordering investigations, making sure that we've got basic blood tests, including FBE, UNEs, group and hold. And the investigations are indicated depending on the nature of the elective procedure and also depending on patients' factors. Sometimes we need to order like the latest ECG or X-rays or an echo or a spirometry. It all depends from patient to patient. Sometimes, for example, say a patient has total knee replacement surgery, the surgeons would want X-rays, including specific X-ray views like weight-bearing views of the affected joint, things like knee sunrise view or PA view in 30 degrees flexion. So as a junior doctor, it becomes your job to make sure that, the hospital system has these available and all of this is ready to go for the day of surgery. So there's a couple of things that we do in PAC. So we check for the latest bloods on the file and also check if we need a blood group and hold. We do medication management. We can withhold or start certain medications a few days prior to elective surgery. Medication management is where we have a few cases in AMC, particularly anticoagulation management in PAC. So you would need to be familiar with how to do that. You need to know when to stop or continue drugs like warfarin, have like a good knowledge on bridging anticoagulation. I would do a detailed video on cases at a later stage, but feel free to go and look at the warfarin video that I have done recently. In medication management, we're helping patients manage chronic diseases prior to surgery. We're giving them advice on what to continue and what to stop, and until when do they need to stop these medications. Another important thing that we do in PAC is consent and paperwork. We explain the procedure to the patient and also ensure that, we've got consent forms ready to go. In explaining and counseling, we are usually counseling on what happens pre-op, intra-op, post-op, and discharge, so as the patient can plan their life accordingly. Say, for example, someone's scheduled for a total knee replacement. They need to know how long will they be in hospital, for how long will they take before they start walking independently, so they can organize and help, try and get help for themselves, things like that. The other thing that we do in PAC is assess and refer complex cases to the anesthetic PAC. Our goal in PAC is to assess perioperative risk, optimization of medical conditions prior to the surgery, planning post-operative care, including pain management. And whenever we have doubts, the home team and the anesthetic department are always available to offer help and advice. We also try and assess and see which patients should be referred to PAC anesthesia. The Department of Anesthesia and Acute Pain Medicine are able to offer services in order to help with appropriate pre-anesthetic workup and optimization of your surgical patient. They can, for example, review in PAC anesthesia for elective surgical patients, or review patients on the ward for somebody who is an inpatient or somebody that's an urgent case. They can offer us phone advice where appropriate. They can also offer review of notes and then do a phone consult with patients who, are probably not nearby the hospital, somebody who's in regional remote setting. So we can get help from PAC anesthesia in multiple ways. Some patients must be referred to PAC anesthesia based on the surgery that they're having, regardless of their health status. For example, say mandatory PAC anesthesia clinic would be for all patients having surgeries like cardiac surgeries or colorectal surgeries, thoracic surgeries, upper GI surgeries, orthopedics like joint replacements or neurosurgeries, any surgery like where, the expected duration is more than 8 hours, major ENT surgeries or major plastic surgeries. Other situations in which referral to PAC anesthesia or discussing with them the patient is important is, say, if a patient had a past history of anesthetic complications, they had severe chronic pain issues, they had severe liver or kidney problems, they have like significant preoperative malnutrition or anemia. Other than that, we have unit-specific guidelines when it comes to PAC, and patients should be referred to PAC anesthesia according to those guidelines. Okay. In general, so anesthetists are able to help with specific issues, or where you're a bit lost, you don't know what to do, you can talk to them. Where you're concerned about fitness for surgery, say somebody is significantly short of breath and you're wondering, oh my God, like this person can't even take 5 steps, how are they going to be fit for surgery? So just pick up the phone and talk to them or make a referral. Or somebody who has complex issues regarding, say, acute pain management, or they're like complex and high risk, and there needs to be planning. In Australia, we also have what's called the perioperative medical unit. It's called PMU, and they have their own guidelines and referral pathways. In general, a referral to PMU is more appropriate when, say, there are multiple medical problems needing assessment and management before the surgery, or they are likely to be a medical issue requiring PMU management in the immediate post-operative period. Planning is very important in all aspects of life, and the purpose of PAC is to plan for a better outcome. And that's why we look into PAC anesthesia, complex preoperative investigations, or think of, booking a HDU bed in advance. You must be thinking how to refer patient to PAC anesthesia. Well, all patients need a brief written referral. There are hospital-specific processes. At my place of work, for example, all patients needing a referral must have a completed form. It's called NSQIP risk assessment form, which is like a surgical calculator. This form can be completed in like 2-3 minutes. And once it's done, you send it over. And then the anesthetic department can help. All right, everyone, that's about it for PAC. Don't forget to hit like and subscribe, and feel free to leave comments on what type of videos you'd like, and I'd be happy to share my knowledge on those topics. If this was useful, hit the like and subscribe, and I look forward to seeing you in another video. Until then, take care of yourself and be kind to those around you.